My name is Melissa Pitts, and I've been a nurse at San Francisco General for 9 years. I have spent most of my time in the emergency room and 1 year in the surgical ICU. Currently, I serve as a charge nurse. I'm here today to respectfully ask that you consider the critical nursing shortage impacting both staff and patient safety in the emergency department. I am proud to work at San Francisco General. I love what we do in the ED. Our job is to care for anyone in the city, no matter who they are, what they can afford, or what happened to them. The homeless person you walk by on the street, the mom that gets hit by the car, the person that is having a heart attack or stroke, and when every second counts, we are responsible for taking care of all of them and so many others. I take great pride that our hospital is the only level 1 trauma center in the city. With the tremendous growth in the city, it is simply not possible to absorb the influx of new patients with the current numbers of nurses scheduled per shift. When fully staffed, we should have 22 nurses and a charge nurse. Yesterday, we had 10. Under those circumstances, when trauma happens, like the woman who was hit by the BART train last night, we have to stop what we're doing and react. The solution was to pull people with other obligations, and that's just not sustainable. Because yesterday wasn't an exception, it's quickly becoming the norm. When we're short-staffed, less critical patients wait while we deal with the trauma. Chest pain workups get delayed. The 80-year-old with a broken hip can't go to the bathroom. A little kid with a fracture waits for sedation to splint his arm. We make it work, but as nurses, we are being faced with impossible choices that are compromising care. And the ED team does not shy away from challenges. I was in charge the day that the Asiana flight crashed. Nurses, doctors, aides, and administrative staff all came in to assist without even being asked. We know what it takes to make the emergency department function. When tragedy strikes, we deliver. But we need your support to run an effective department on a day-to-day basis. And that means more nurses and more ancillary staff on every shift. Soon we will be moving to the new facility. I have very serious concerns about the staffing ratios for the new department, where even more coverage will be needed. I, like many of you, have had a sick family member, and we all want our loved ones to get the best care, to receive pain medication quickly, to never have to wait for a bedpan. As nurses, we want all of our patients to feel safe and that they're being tended to without distraction. I hope that we never meet any of you at the hospital, but I would like for you to take a minute to think about the fact that any one of you, any one of us, could be a patient in that emergency room. We are dedicated nurses who want to give every patient the time and care he or she deserves, and we ask that you help us work together to make that a reality in a safe, efficient environment. Thank you.
Thank you. As